HECTD. My name is Ava. Today we will have an interview with Professor Dr. Volkan Turan in Gynecology and Obstetrics Department. Hello doctor, hope you're doing well.
Thank you, I'm fine. You?
I'm fine, thank you so much. As our topic is about IVF, doctor, what is IVF?
IVF, normally in a human body, for a baby, the sperm and the egg should find each other. In IVF procedure, we collect the eggs and fertilize them with sperm in the lab and create an embryo, then transfer it to the womb of the uterus of the patient.
I see. And who can benefit from IVF?
Low sperm count, or sometimes azoospermia, which means there is zero sperm. Also for women whose channels are blocked or doesn't work, who doesn't have any tubal patency, and also women who have low egg reserve or irregular menstruation periods. Also the women who have endometriosis, PCOS, polycystic ovarian syndrome, are all the candidates for IVF.
I see, doctor. And how successful is that?
For live birth, actually, 40% success rates all over the world, but it depends on women's age. For example, for women whose age is more than 47, we don't recommend them to have IVF.
The question is, how long does the IVF process take?
The IVF starts on the second or third day of women's bleeding, women's period. We use some medications like injections on the second or third day, and it lasts for 10 or 11 days. Every day at the same time, they injected the medications to the belly button, near the belly button, and after 5 days we check under ultrasound to see if eggs are growing or not. And at the end of 11th day, for example, we give some anesthesia for 5 minutes or 10 minutes to the woman to collect the eggs, and on the same day we fertilize them with the sperm. But after that we wait for 3 or 5 days for embryo development. If the embryo develops well, then we transfer the embryo.
That's quite interesting. What medications are used during IVF?
As I said before, we use some injections, sometimes one, sometimes two in a day, and they are easy to do because like diabetic people's injections, like insulins, every day at the same time they injected these medications, and every 5 days we control the eggs, and almost 10 days later, after these injections, we collect the eggs.
I see. The next question is, what happens to unused embryos?
This is a good question because if we have surplus embryos from the couples, then we freeze them for future use. Because if they achieve pregnancy, they can come 3 or 4 years later to have their sibling. And also, if they failed to achieve pregnancy, then without egg collection, they can use their frozen embryos.
I see, doctor. What advancements are used in IVF? This is the last question.
Yes, actually lab technology is very important in our job because we use some special devices to increase the embryo quality and pregnancy chance. For example, for men, we use IMSI, magnify the sperms 6,000 by 6,000 times to see the sperm more clearly, and we can choose the best one with the help of this device. And for women, we use spindle technology. Spindles means they are used for regular division of the embryo. And if you harm these spindles during this fertilization, then the embryo quality will be lower. And we can see the spindles with the help of this device, and we can insert the sperm at the right place. We can insert the sperm into the egg at the right place and increase the embryo quality.
I see, doctor. That was all my questions. Thank you very much for your time.
Thank you.
Have a nice day. Have a nice day,
You too.
everyone.